Hello, my name is Brian Hartnett. Welcome to my presentation for Nursing 346, uh, titled COVID-19 in New York City. What is COVID-19? Coronavirus is a respiratory virus caused by the SARS-CoV-2 strain. This new virus has had a particularly damaging effect to the world's population due to its high rate of communicability. COVID-19 is believed to have started in a food market in Wuhan, China. The first reported cases were in December 2019 and reached New York City in March of 2020. COVID-19 symptoms can range from mild or no symptoms to severe illness. This is another factor in its communicability. Those who do not have symptoms can still spread the virus. When and where? COVID-19's effects have been felt worldwide. Not since the Spanish flu epidemic of 1918 has the entire world been devastated by a virus like this. This presentation will focus on New York City. Due to New York City's frequency of international travel and congestion of population, it was affected by COVID-19 more severely and quickly than any other location in the United States. As of April this year, New York City has reported 7,067 deaths and 159,937 total cases of COVID-19. At that time in the world, New York City had more cases reported than anywhere else. As of April 2020, 8 members of the FDNY who were exposed to COVID-19 had died from it. Media reports in the COVID-19 epidemic in New York City. Sierra Madad's article described the structural response of New York City to COVID-19. It became clear that our community represented essentially the very epicenter of this terrible outbreak. From March through May of 2020, New York City's patient load increased by 10,437 cases of confirmed or suspected COVID-19, including more than 2,000 patients to ICU beds. This increase in volume is tragically significant and requires a significant rise in resources to accommodate. Another news article written about New York City's response to the COVID-19 epidemic covers the cost of the response in human resources. Urshel Boone explained in an article written for Spectrum News NY1 that 8 members of the FDNY had died of COVID-19 as of April 2020. This is a tragic loss to the department and has made a marked effect to morale. The full effects of COVID-19 are not known. While only 8 deaths occurred since April, it is unknown and undocumented how many responders will have lasting detriments to their cardiovascular systems and their ongoing emotional responses. Media reports of the COVID-19 epidemic in New York City. News articles from March of 2020 can offer an interesting insight of what the city was preparing for and expecting prior to feeling the full effect of the virus. Jonathan Allen from Reuters writes, by the time the global coronavirus outbreak arrived in New York this week, the city was armed with hundreds of hospital beds, a growing stockpile of diagnostic testing kits, and enough disinfectant to wipe down the entire subway system. The city had clearly attempted to prepare for the onslaught. This may have offered hope for the future to the New York City residents reading the article and preparing to weather the storm. This article also shows that as early as March, hospitals were mandating staff to use single-use masks for the entire length of a 12 to 18-hour shift, understanding that early on their current supplies may not be good enough to get them through the outbreak. Public response. One of the ways New York City reacted to the threat of the COVID-19 was the deployment of the USNS Comfort. This ship arrived at the end of March as COVID-19 reports were rising in the region. The plan for the USNS Comfort was to treat patients unaffected by the coronavirus in an attempt to relieve stress on the New York City health system. This would allow New York City hospitals to redirect resources to treating the pandemic. USNS Comfort arrived in New York City to provide relief to frontline healthcare providers, and each patient who brought aboard ensured one more bed was available in a local hospital. Vice Admiral Andrew Lewis. The USNS Comfort is equipped to perform surgery, CT scans, X-rays, ultrasounds, It can hold up to 1,000 patients and has a staff of 1,200 servicemen and women. Effectiveness of public response. After deployment of the USNS Comfort on March 30th, it was recalled April 30th. It was deployed for only 1 month and served less than 200 patients in that time. When asked for comment regarding the ship's recall, after only needing coverage for so few patients, spokesman Jonathan Hoffman continued, "It is a sure sign of modest progress in mitigating the virus in the nation's hardest hit city." Many news outlets have mentioned the necessity of flattening the curve. This phrase describes the attempt made to limit the amount of affected individuals within the limits of New York City's healthcare system to treat them. If you look to the graph to the right, you will see this illustrated. The measures responsible for flattening the curve and the early recall of the USNS Comfort include social distancing, public use of face coverings, and personal quarantine mandates. When a problem is large, or barriers to the public response. With a problem as large and intricate as an epidemic in the largest city in America, there are many factors that make defeating it difficult. The first and most disappointing factor I've seen in regards to fighting COVID-19, I've seen is in politics. 2020 is an election year in America. These statements from health professionals tend to simplify the equation by only focusing on one issue, limiting the spread of the coronavirus or the virus. Policymakers, however, have to take into account the side effects of public health measures and other interests at stake, says Antion de Benji Peluval, doctoral research fellow at the Center for Development and Environment, University of Oslo. Other more tangible barriers, including geography. New York City is a dense population center, and a subway car on a weekday could have 100 people in close proximity in the narrow metal tube. The last barrier to an effective response, I believe, is arrogance. So when you're saying what happened in other countries versus what happened here, we don't think it's going to be as bad as it was in other countries. Governor Andrew Cuomo was quoted saying this on March 2nd. I understand that hindsight is 2020, but I believe this quote shows an arrogance that New York could not be affected by this epidemic when we've learned the hard way that it was just not true. Facilitators to the public response. New York City is one of the richest cities in the world, and that comes with facilities and expertise. Our experts are world-renowned for their epidemiology, surveillance, and response work. New York City Health Commissioner Dr. Arthur Barbeau. These resources have absolutely aided New York's COVID-19 response. Another major facilitator to aid New York City in this time of crisis was the USNS Comfort, although it was not as necessary as it was originally thought to be. Maureen Miller, PhD, an infectious disease epidemiologist and adjunct professor at Columbia's School of Public Health in New York, accredited New York City's success with COVID-19 epidemic directly to the public. They stopped all business. They insisted that there be no social gatherings. They had shelter-in-place laws and enforced the fear. People were terrified. We had watched what had happened in Europe, and then suddenly it's happening in New York City, our home, she said. Lessons learned from public response. I feel the most notable thing learned from New York City's response to COVID-19 is that simple measures like social distancing, personal quarantine, and the wearing of facial masks in public can aid in limiting the spread of viruses. This is evident by New York City's success in keeping the curve of spread within the capabilities of New York City's health system. Another aspect learned from this epidemic is that there is no city, despite its resources, that is safe from a pandemic like this. Governor Cuomo early on in the pandemic thought, "We don't even think it's going to be as bad as it was in other countries." He believed that New York City's advanced infrastructure and health systems would protect it better than the rest of the world. In the end, it was a simple quarantine measure that flattened the curve. I believe it can also be said that the response was late in coming. political factors became apparent influencers in key decisions to isolate and suspend business. Key officials in New York felt assistance was too late in coming. President Trump failed to mobilize federal aid in late March and early April, minimized the coronavirus threat, clashing with his own medical experts. Lessons learned from public response. There is even evidence that measures taken to alleviate this crisis made it worse. Some patients may have been transferred against regular operating procedures. Patients that were too severe for transfer between hospitals. Bickering amongst the Cuomo and de Blasio administrations contributed to disorganized response efforts. Inadequate adherence to isolation protocols. Hospitals sometimes mixed infected patients with uninfected patients. This contributed to the spread of COVID-19. Inefficient planning for staffing. Hospitals added hundreds of ICU beds, but had them staffed with nurses who did not possess the adequate training. On a more personal note regarding this, I am curious as to what would have the response have been in New York if anybody that had been alive or in power during the flu epidemic of 1918 were around. We saw this happening for months in China before it came to the US. And I remember a complete level of hubris amongst myself and other professionals that this isn't going to happen here. And it really just goes to show you that there is just some things that we can't prevent. Thank you.